I'm Dr. Graeme Reed. I'm the medical director here at Ali'i Nani Aesthetic Medicine in Kapolei of Hawaii. And today we're going to be demonstrating a technique of reducing the appearance of stretch marks. Stretch marks are a problem for a lot of people. Technically they're called stria distensi, and in this case we're going to be working on a patient who noticed these stretch marks after having given birth, and in this case it's called stria gravidarum. The pathogenesis of stretch marks isn't terribly well understood, but there are some techniques that can be used to help reduce their appearance. Typically they're completely asymptomatic and don't require treatment except for cosmetic purposes. So they can be quite disfiguring. So one of the methods, and the method that we prefer to use here, is non-ablative infrared laser therapy. We use a 1540 laser, and this seems to be quite effective. You need about 2 to 3 treatments spaced approximately 4 weeks or a month apart, and of course nothing's eliminated entirely, but it does show a lot of reduction in the appearance of these marks. Okay, so this is the icon, the cynosure icon, and we've set it up here with the 1540 fractional non-ablative infrared laser, and this is using a tip called the XD tip, which stands for extra deep, and that creates these columns of lasers that go into the skin. They heat the water, and then what happens is that the tissue regenerates, and that reduces the appearance of these stretch marks. Now, for this treatment, a pulse width of about 15 milliseconds, and we can use anywhere between 40 to 60 millijoules per square centimeter as far as energy is concerned. We'll start on the 40, and if our patient tolerates it well, and depending on, of course with this we always like to do a test pulse first, and we have a look at it, and if there's no reaction, then we're a little low on the energy. If there's too much of a reaction, then we're a little high. So we'll do that first. Okay, so you can see on our patient here we have quite a few stria marks around here and around here, and this is kind of a typical thing. This has progressed to stria alba. Normally it starts with stria ruba, which is kind of a more blood vessels involved, and it's a kind of a purpley red color, and then it progresses over time to the stria alba, where it takes on more of a scar-like appearance, and this is where this is at the moment. So I think this should respond quite well to the fractional laser. Let's try a test spot. So this will feel a bit like a rubber band flicking your skin. Are we on? Now we're on. Okay, so let's just try a spot right here. How was that? Was it too painful? Not painful enough?
No.
Okay, alrighty, so it sounds like we're just about right. So what we're going to do is we're going to go up and down these stretch marks, and we're going to do it about 2 times, and we're going to overlap by about 50% each time, each square. You can see that this is a square, so we do it, and then we move ahead a little bit so it overlaps by about 50%, and we just do that methodically. And I see the first one is right here, so now you can see it's getting a little red where we did the test spot there, so I think we're probably just about right. Okay, let's go for real this time. You're not flinching anymore. Is it all right?
It's all right.
You can still feel it.
Mm-hmm.
Good. Okay. So I've got this machine set to automatically pulse, I guess it's every half second or so, and that way I can just keep my foot on the control pedal continually and kind of time my movements so that I don't have to keep pressing and releasing the control pedal, which makes it a little easier. So you can see that our patient is developing a little redness in the area over which we have treated, and that's normal. She's going to feel like she's got a bit of a sunburn for a little while after this treatment. However, there's really no downtime, and that's one of the beauties of the various laser treatments that we do here. And what does it feel like?
It just feels like a little zap.
A little zap. It's interesting when we treat people. Some people have, well, everybody seems to have different tolerances for the pain. Sometimes we can use a topical anesthetic compound, which takes the sting out of it. Have you ever had any other treatments for this before?
No, this is the first.
This is the first time. So we chose 40 millijoules per square centimeter, which is pretty much the minimum that you'd want to go for this application. Anywhere between 40 and 60 millijoules per square centimeter seems to work the best. You'll also notice that there's no flash of light, and that's because this is, of course, infrared, and so it's invisible light, and so you might be thinking that, well, you don't have to wear eye protection. Well, you do. This is a laser, and you don't want this stuff getting in your eyes. Okay, let's start again at where we began, and you can see that we have been pretty good as far as covering this entire area, but we want to be sure. So let's do it one more time. So the laser goes in and basically boils the water inside the cells, and in columns. And so then you get regeneration of the skin and of the surface. So this really works well for surface problems. Any discomfort in the areas that we've finished already?
No, none.
Nothing? Well, we'll see. Now, some people, they need, we have we can provide ice packs. Some people feel, as I mentioned, that as if they've had a sunburn in the area, and often we provide ice packs to help provide some more comfort after we've finished the procedure. So we're almost at the end of the second pass, and you can see now that there's a big area of redness and erythema. It's a little bit erythema and a little bit of edema, and you can see it's a little bit swollen, a little bit edematous, and that'll resolve, within hours. And the redness will likely resolve within hours as well. Okay. How are you feeling?
Good.
Good. Excellent. We finished the treatment, and of course aftercare treatment is important, or after treatment care is important. One of the important things to remember with any kind of laser treatment is to avoid sun exposure afterwards. one of the complications that people sometimes encounter is hyperpigmentation. So we want to avoid that, and the best way to do that is avoid sun exposure. Also, always wear SPF 50 or greater sunscreen. If there is any pain or burning, ice can be helpful. Tylenol for pain, and we'll check it again in about 4 weeks and see how it's looking. Okay, so that concludes our demonstration of the icon for stria distensi. If you have any questions, or if you're interested in any of the treatments that we do offer, because there's a whole lot that we offer in terms of resurfacing of the skin, color, pigmentation problems, fine lines, wrinkles, the blood vessels coming close to the skin, those kinds of things, then give us a call here at Ali'i Nani Aesthetic Medicine. Our telephone number is 674-4300. We'd be happy to talk to you and have a look to see if any of our treatments would be applicable to you.